it's fascinating to me, and we talked about this a little bit this morning as before we got started here, that the idea of some type of national healthcare program or policy is very closely linked to the civil rights movement in this country. So that we've been, whether we've really understood it in this way or not directly, or whether we understand it that way today, and we should, the idea of healthcare is really a civil rights issue.
It certainly is. And there's a great book, which is just out maybe a year ago, by David Barton Smith, entitled The Power to Heal. Dr. Smith is a economist, and he teaches at Drexel. And basically what he does in this book is to remind us as to how the Medicare and Medicaid statutes came about back in 1965. And those who study history or are old enough to remember it, understand that this is in the midst of civil rights marches for political rights, voting rights, housing rights, etc. And what Dr. Smith does in this book is to say, how did it happen that the one national statute that was passed in terms of health care was implemented so quickly? And he says that it grew out of discrimination that was taking place against African-American doctors and patients. That was a point in time when hospitals were segregated. Physicians who were African-American could not get staff privileges. And the marvelous thing is that changed within a year, because when they passed the Medicare statute, they said, if you want money from the federal government, then you must be fair. You must treat all physicians and providers fairly. You must treat patients